Today, we are pleased to have with us Dr. Ahmed Al-Qahtani, and he'll be discussing the role of growth factors for AQ Skin Solutions. AQ Skin Solutions is an award-winning cosmeceutical company based in California who specializes in growth factor products, which, as we know, the science and the biochemistry of regenerative medicine often includes cytokines and growth factors. So, Dr. Al-Qahtani, thank you so much for being with us today, and look forward to your presentation on skin health and growth factors.
Yeah, thank you for joining us. Today I will be talking about regenerative medicine updates and more particularly about growth factors. My name is Dr. Ahmed Al-Qahtani. I'm an assistant professor at the College of Medicine and Health Sciences in the UAE. So what is regenerative medicine? And I'm sure many of you who will be joining us or be attending this presentation have a great idea about what regenerative medicine is. But just to sum it up, so regenerative medicine is defined as the method to regrow, repair, or replace damaged or diseased cells, organ, or tissue. And usually when we talk about regenerative medicine, we talk about growth factors, we talk about stem cells, and recently we've been talking about exosome. This video I borrowed, I'm sure some of you are familiar with. So what happened here, they caused an injury in this site and wound. And once you have a wound take place here, then you have a lot of cytokines and interleukins or growth factor in general are being produced in this site. We call them chemokines. As immunologists, we call them chemokine. And what it does, it starts recruiting cell toward the site of injury so it can be repaired. And I want you to go, I'm going to go back a little bit here. We see this circle, this round cell here that's coming out. Usually when you see a round cell in the body, you see this round cell here. When you see a round cell in the body, mostly it's stem cell. So stem cells really come in disc-shaped cells. But you see not only stem cells are actually migrating towards that. You see other things, like macrophages, dendrocytes, lymphocytes. Other type of cell will start migrating to the site of injury to repair it. All this is orchestrated by growth factors. Growth factors are the signaling molecules that will allow these cells to be recruited and the site to be repaired. So they are the conductors of this orchestra. And for you to have a fully functioned body, or if you want to have a fully functioned repair system, you really do not rely on one type of cell. You need multiple cells. And all these cells are recruited by growth factors. And also depending on the type of injury, the growth factor will determine what type of cell they will require. So this is really tell the story what regenerative medicine is. I want to talk to you about technology that I developed in 2006, and it's getting patented globally. It has patents called growth factor technology. And also talk to you about something called growth factor-induced therapy, which is a therapeutic mean utilizing growth factors, and it's also trademarked and recognized by the US. So what it is, so what is growth factor therapy? And they call it induced therapy or GFIT. So it's the use of different modality in combination with growth factor. For example, microneedling, lasers, energy-based devices like radio frequency, and even in chemical peels, you can use growth factors. So I want to talk about this paper here that came out. You can see it. It came out in September, 24th September, which is 4 months ago. Talk about the effectiveness of growth factor-induced therapy, which I just showed you the GFIT, for skin rejuvenation, which is the case series. And this has been sponsored by the British Academy of Aesthetic Medicine. It's also made in the University College of London, also in the King's College of London, and in the Chirurgie Aesthetic was in Toulouse in France. So it's a multi-center study. And here the objective is to combine microneedling is combined with growth factors. And here they mentioned that the growth factor that has been used is AQ Recovery Serum, which is a concentrated growth factor product. And they want to see how, and they recruited 30 women. And they did, what's interesting, they have, all these women have different ethnicity backgrounds. So they recruited Chinese, Caucasian, and Latino. Different ethnicity with different type of skin and different type of skin tones. And what they show here, the improvement of patient by age group. And they find out all patients have seen improvement, but most patients that see improvement are between the age of 40 and 49. And we know in aesthetic and in other anti-aging and other disciplines that really the clock or the appearance term, and when you hit 40, between 40 and 49, is when your age start changing, your skin tone start changing, your skin laxity start changing, you start losing support and so forth. So it makes sense that this during this time or during this group of people where the growth factor is actually at maximum effect. As we get older, 50 and between 50 and 59, there's also a huge amount of improvement that take place, but not as much as the changes you see in between the age of 40 to 49. And also they looked at the brightness of the skin, the overall skin appearance, the skin texture, tightness, pores, wrinkles, and pigmentation. And you can see they score in all categories. The growth factor has been extremely effective. And they measure this using a VISIA, a system that will go and really see the difference in terms of collagen distribution, collagen skin tone, sun damage, and multiple factors. So what did they say? This study used AQ growth factors, and then the reported efficacy of this treatment modality cannot be exploited in the growth factors. So basically what they say that, this result had came as a result of utilizing the right growth factors. And they also talked about that, not all growth factors are equal, and you have to look at the source. And he mentioned that the source of growth factors is important, and the manufacturing should be done in the pharmaceutical facility. A variety of sources are used to obtain growth factor. This include the recombinant bacteria and yeast, and they talk about other source of growth factor that they say it's not going to have to come source from a human. And they talk that the growth factor are morphogenic protein, therefore factors affecting stability of this protein should be understood and taken into consideration. So when you start, for example, fibrous growth factor. So they say here, when you start looking at growth factor, you have to look at the manufacturing process, you have to look at the source of it. It has to be in the pharmaceutical quality, and also you have to keep in mind that this growth factor effectiveness depends on their stability and how they are manufactured. Another paper I would like also to talk about was conducted in the University of Cairo, the Faculty of Medicine and Dermatology Department, as well as the National Research Center. And what they did here is very interesting. So they used, and the first paper I showed you was using microneedling. This one is using laser, fractional laser. And what happened here, they did a split study where one side of the face are used laser alone, and the other one is laser in combination with growth factors. And so the laser used was DECA laser, and they use fractional laser, carbon dioxide laser, DECA, and then the growth factor, they use the AQ recovery serum, again, just like the paper before, as the growth factor source. And what they found out that the fractional laser only treated people who got treated only with fractional laser, it took them around close to 12 days to heal. Whereas people who got combination with the fractional laser as well as growth factors, it took them around 5 days to heal, between 5 to 6 days to heal. So basically, they concluded that when using growth factors in combination with laser, you get the healing process is reduced by 50%. So you heal faster by a ratio of 50% as opposed to using fractional laser alone. And not only that, but they also showed that the quality of healing or the quality of result that comes when combining growth factors and laser, or as opposed to laser alone, is much better. And you can see the quality here of the patient that they use. Now, they said here with laser, unfortunately, when using ablative laser, there are a lot of side effects, especially people who have darker skin, which is between Fitzpatrick 3 and 4. For example, they usually tend to develop hyperpigmentation and hypopigmentation as a result of the inflammation. So they say here, getting healing faster will be a great help in reducing these side effects. And they also talk about here that, using growth factors is advantageous in the sense that, this growth factor is calculated accurately. So they say when you use it in comparison to PRP, they said here when you use a PRP, a lot of people are confusing PRP and growth factor technology. And I'm going to show you a slide later on in comparison. But here they said to avoid this complication, multiple post-treatment therapies are prescribed, including potential topical steroids, sunscreen, and other healing agents. Some author also suggested PRP. But here they say that using prepared GF cocktail, where the dose of the GF is calculated accurately, give you a lot remains unknown when in comparison to PRP, give you an advantage. So they say basically when you use a PRP, you don't know really the concentration of this growth factor, you don't know the combination of this growth factor, but when you use a controlled cocktail of these growth factors that you know accurately what are these growth factors are, then you are more consistent and you'll get the result you want. Another paper, and this paper came actually 2 months ago in December, 14 December, I think less than 2 months, a month and a half ago, in December 2020. And here they talk about the favorable-derived humoral growth factors in preparation for the management of rhabdodermatitis. So rhabdodermatitis actually is people who are going through cancer therapy using radiotherapy are, who develop this. And here what they say in the introduction, they said approximately 95% of patients who are going through radiotherapy will develop some degree of rhabdodermatitis. And they say here at the present there is no unanimous agreement regarding recombination to prevent or treat rhabdodermatitis. So there, until today, there's no really set protocol for those people who go through radiotherapy, mostly for treatment of cancer, have no standardized treatment for this. Popular treatment for cancer, 95% of them will develop that, yet there's no protocols and treatment for this. So this is why this group decided to publish this paper. So this group is in Greece and in the United Arab Emirates in Dubai. So they did this, and this is how it looks. Rhabdodermatitis, basically a lesion that comes in where the radiotherapy actually attack the cancer cells. So you focus the radiotherapy to the skin, and you have this large lesion, which is very painful stress to the patient. So here, the treatment plan was to use aqueous skin solution active serum, which is another daily use of growth factors. And they said they asked the patient to be used twice a day, 24 and 25th sessions. So this is what they basically use it twice a day, apply it twice a day, and then they follow the patient. This is 15 days post-treatment, post-chemotherapy, and this is 25 or 16 days. This is 12 days post-treatment, this is 16 days post-treatment. You can see the improvement is clearly tremendous to the patient, and they see this. They follow the patient after 6 months to see if there's any scarring, discoloration, or any of that, any remains of the rhabdodermatitis. And you can see it was clear skin. I called the author, I asked them, their thought and what happened, and they're really pleased because they said, from their experience, patients who develop rhabdodermatitis actually always lived with a severe scar and discoloration in the area. They describe it as has a huge psychological impact on the patient, moving forward in their life after they get, healed and so forth. So quite a good paper. And I like here they said in the skin reaction to the treatment with ionizing radiation for breast cancer can be both physical and psychological distressing. And this is really the point they want to emphasize, not just the physical stress that comes with this radiation, but also the psychological effect that comes from this. And they showed, and they thought for this to be elevated, we need to show a rapid and orderly healing as a significant reduction in pain and virtue. So they said basically, in this paper, they say that patients who really get a rapid healing and an orderly healing, they end up recovering fast, as well as, reducing their stress, their psychological impact. So they say really this treatment not only take care of the skin and heal the skin, but also help the patient psychologically as well. And here they say significant reduction in pain and virtually no scarring has been shown after the treatments. So this is really a great paper, and it's available. If you email me, I'll be more than happy to share it with you. It's a great paper, really addressing one of the major issues that comes with radiotherapy for mostly for women who suffer from breast cancer, but not only limited to breast cancer, but other type of rhabdodermatitis. I'm really happy to say that after this paper came out and it's had huge impact, the AQ Active Serum have won the Annie and Stoll Award, which is one of the most prestigious awards given in cosmetics, and has been a tremendous achievement, really, to see that this organization, these awards, look at not only the aesthetic part, but they also look at how, in fact, how it helps patient and people in general in different type of settings. So I want to just stop here really quick to reflect on the mention in the paper that when they talk about PRP and growth factor technology. So PRP really, when you take a PRP from the blood and you separate the plasma, what happens is you start getting a bunch of growth factors. You don't know if these growth factors are inflammatory growth factors or anti-inflammatory growth factors. There's no way to know what type of soup you have in this plasma. And you don't, as a result, you don't even know the concentration of these growth factors. The growth factors are very precise signaling molecules. You cannot just use them and random and expect results. They have to be, you have to control the concentration, you have to control the combination of these growth factors. And so when you do a PRP, this is one of the pitfalls of PRP, in my opinion, because you don't know what you're getting. You don't know, which growth factor are you injecting the patient or using on the patient. When you compare to growth factor technology, you exactly know which growth factor you're giving for what indication. So if you want to use it for healing, if you want to use it for rejuvenation, if you want to use it for whatever indication you're after, there is specific growth factor that will aid and get you the result and help you get this result. So if we do like a quick chart comparison between PRP and GF technology, GF technology is safer. Well, PRP, you have a 5% chance of contamination. And a lot of people ask me how this. A lot of the time when we get patients and we do a PRP on them, we take the blood and we spin it. We never run a test to see if this patient actually have HIV, if this patient have hepatitis, if this patient have any blood infection. We don't know. And the chances of having contamination statistically is 5%. So there's always a chance of things can go wrong when PRP, but when it comes to GF technology, there's nothing worry, because you know exactly what you're getting. It's cheaper when it comes to as opposed to PRP. PRP, you have to get the kit, you have to spend, you have to use a lot of time to prepare it, and an average PRP treatment take 45 minutes to an hour, where the GF technology is actually take 10 seconds to start, and very there's no preparation whatsoever, so you don't need equipment. You know exactly what you're giving your patient. Save you a lot of time. It's clean. You don't have to deal with the blood, discarding the blood, and taking care of the blood afterwards. So, and high patient compliance. They did a study in the UK. They looked at people who got PRP treatment, and they said, they asked them afterward, will you do it again? 88% of them said they wouldn't do it again, just because they didn't like the needle, they didn't like the blood drawing, they didn't like the process, So when it comes to growth factor technology, you don't have to worry about this. And it have multiple use as opposed to, when the patient come in for PRP, usually they come for one treatment, you will not be able to do multiple treatments. When it comes to GF technology, you can do face, you can do hair, you can do multiple things at the same time. There's no risk on the patient. So this is one of the advantages, or some of the advantages, that the growth factor technology brings versus PRP. And it's a great alternative to PRP. So moving forward, so now we finish with the skin, let's go with the hair. This paper came out on 2017, and it's became one of the most influential paper actually for hair restoration and hair loss. And what they did here, they combined CO2 laser therapy with hair growth factors. So they want to see if our growth factors effective in restoring hair and improving hair loss and treating mostly androgenic alopecia. So this study was done in the University of Shanghai and University of Beijing, multiple centers in China. So they did the study. And what makes this study really popular is the fact that they show global improvement of 93%. This has not been shown by any treatment in the world. This is the highest ever result being recorded. It's better than minoxidil, better than anything else. That improvement using growth factors. And what's interesting about this paper is usually when we see papers about addressing hair loss, you see before and after. So you see a patient have no hair, and then you have to see a patient that have hair. So what they did here to avoid this type of inconsistency sometimes, what they did is they used the same patient and they did a split study. So one area will have the combination and one area will have only one treatment. So they did it in the same patient, and you can see here the difference in one side over the other. And they did a count for the area after 4 months of the treatments, and there's the improvement that you can see. And not only that, but they went ahead and they want to see, okay, having restoring hair growth is one thing, but they also want to see the quality of the hair. Is the hair quality better? I suppose because some treatments, for example, from minoxidil and finasteride, with their side effects, the quality of hair usually is not optimum. So yes, you might have regrowth, but you will not have a high quality of hair. Here they showed not only you have regrowth, but the quality of hair is actually much better and healthier. So they show that I think 30% improvement in the hair diameter and color. So it's very interesting paper. And again, here they mentioned that the patient went and they used the AQ skin solution hair complex. They wrote their protocols, how it's done, and so forth. And this has been one of the great paper for that year that came out for hair. And of course, in 2018, after this paper came out, the AQ hair complex won the best hair product of the year by My Face My Body Award globally. So we're very pleased with that, and this is really a testimonial of this technology. Now, let's talk about some misconception regarding the growth factors and some warnings I would like to talk about, because I was advised by some of the people to bring this up because of what's happening around us. So, do stem cells produce growth factors? Now, I showed you in the video, the stem cell require growth factors to be recruited. So the stem cell, stem cell and growth factor work so close together, and this is where the confusion is. The stem cells do not produce growth factors they just don't come and just produce growth factors. They require growth factor to differentiate, to become a functional cell. So they need growth factors to tell them what to do. They just don't go and produce growth factor randomly. So this is where the problem is. When you talk to people, you see a product saying, oh, we have adipose drive conditioned media, growth factor. We have mesenchymal stem cell, bone marrow growth factors, stem cell conditioned media. Big problem, because this show that obviously they messed up the science, big deal. But I believe this is done because to avoid the patents, so they couldn't use fibroblast, which is, patented by Allergan and AQ. So these are the two companies that have the patent for the technology. So people start finding other ways to go around this patent and using wrong science, because the close proximity between the growth factor and stem cells. So people think, if we put stem cell and put growth factor, then you'll have, the best of both worlds, which is not true and doesn't make sense. So please, if you see or you hear product that advertise growth factor from stem cells, then you have to be careful. There's no such thing. Another thing that I also would like to bring to mind is like when people say this growth factor come from plant. Plants' growth factors do not work on human. Remember, growth factor are signaling molecules. They require receptors on the cell surface to be activated. So the growth factor that come from plants will not occupy human receptors. There's no analogy. We have different DNA than plants. We have different physiology than the plants. The plant growth factor will not work on human. And so it doesn't matter if the plant is rare and somewhere in the Alps or some mysterious place in the world. It doesn't matter. If they don't match our DNA, it will not work. Don't be emotional and think that, plants and organic plants and some rare plants will work for a human. They will not work. And just because, growth factor, they don't have this ability to skip species and start making things. So this is a warning that I would like to, emphasize here. And I want to give you example. I block out the name of the company, but I want to give you example because a lot of the time when I talk about this, people think I'm exaggerating, and I want to just give you a quick example. So this product that come, in the market was advertised as aesthetic magazine, and look what the aesthetic examines the science and the uses of a new skincare range that is formulated using stem cells from the umbilical cord lining of a New Zealand red deer. Now, I don't like to talk about other brands. I don't think it's a good taste, or I don't think it's it's fair in the sense. But I'm going to show you why I brought this up, and I want to, because of the warning that came up. But why will somebody go and get stem cell from umbilical cord from a lining of a New Zealand red deer? What is so special about the red deer in New Zealand? Absolutely nothing. However, this is the marketing, this is the thing that goes out to the public and making other people who work on stem cells or serious about stem cells in therapeutic ways, not in skincare like this, but like in therapeutic ways, injecting stem cell in a certain way, to induce healing. But using this, and making it look exotic, and using red deer in New Zealand and umbilical cord and all these things make things difficult and really over undermine the science behind regenerative medicine. So this is one of the reasons why I brought this up. And in December 2018, the FDA, I'm sure a lot of people are familiar with this, the FDA sends warning to a company for marketing dangerous, unproved stem cell products that put patient at risk and put other stem cell firms and provider on notice. And this came out in December 20th, 2018. And, of course, a lot of companies did not take notice, and they continue their daily business. And then 6 months later, this came out, the federal court. So this is from the FDA website. The federal court issued decision holding that U.S. stem cell clinics unadulterated and misbranded stem cell products is in violation of the law. And this was in June 2019, which is 6 months after the warning letter that's sent by the FDA. And it became illegal for this product to be sold and available in the U.S. And unfortunately, some of our colleagues and some people who are clinics that are using this kind of product, they're actually in violation. And so you have to be careful with this. Now, it doesn't come to anybody's surprise that fake growth factor products are circulating right now everywhere, and we have to be careful. And this is just some of the patients that I've seen that have used fake growth factors, and then the doctors will start calling me, asking me of this complication. And when I ask them, what, and they say, we use growth factors, and you're the growth factor guy, so you can assist us. And of course, they're not using the right growth factors. They're using stem cell growth factor and this fake growth factor. And then you have look at this lesion, hypopigmentation. This patient was used for chronic wound, to use growth factor, end up getting gangrene and losing their foot, their finger, their toes. This person developed contact dermatitis, severe contact dermatitis that has to be treated with steroid for a period of time until she got relief. So please be careful when you start using this technology. Make sure that the company, make sure that there's scientific data behind their product, there's certification, there's patent, all these things have to be at your arsenal when you start using this. Ask the right questions so you know what you're giving to your patient. Another misconception that comes out also, a lot of people associate growth factor with cancer. And this have absolutely no scientific backing that growth factor associated with cancer or growth factor cause cancer. To the contrary. So this paper came out. It was done in Brazil, and what they look at the two type of cell culture. They look at the evaluation of safety profile for cosmetics containing growth factors, and here they look at what type of cell, human fibroblast cells. They didn't look at stem cells. They didn't look at any other cells. They know where the growth factor come from, or the right way to look at it. So they studied the human fibroblast growth factor, and then they concluded the cosmeceuticals product containing growth factors as an active principle can be considered safe and for application. So they are very safe, and it's been used for the last 15 years, and I think more, these growth factors, and there has no been any complication associated with them. As long as you know what you're doing, and as long as you use the right growth factors, company they provide you with protocols and training and how to use the technology, and then you'll get a great result, and you'll have happy patients at the end. So with this, I conclude my presentation. Should you have any question, you can email me directly, ahmed@aquskinsolutions.com. You can contact me through social media and Instagram, Dr. AQ Skin, and I'll be more than happy to answer your questions. Thank you very much, Joe, for the opportunity and for making this happen. Thank you.
Dr. Al-Qahtani, thank you so much for that wonderful presentation. I think you did a good job of breaking down the different roles of growth factors in different cosmetic situations. Clearly, hair loss and skin are very important to people, and you look like you have the next generation applications for these, but also the science behind them. So we look forward to learning more about your products as you develop them, and we think it's wonderful that you're approaching such a wide range of clinical applications, including burn surgery, wounds, and other non-cosmetic applications as well.